A cold and asthma are very different things.
80% of people that have inhaler does not even know how to use it correctly.
And some people say, oh, can people with asthma do exercise? They want to, in school, back they say, oh, I have asthma. I'm not doing anything. I don't. In fact, exercise is good for lung function and overall health. Please, when your asthma is managed properly, you can live an active, functional life.
In Nigeria, we self-medicate a lot.
Don't panic when you're having asthma. Please don't panic, because it's only going to make it worse. Like over 400,000 people globally have died of asthma.
It starts quietly, a tightness you almost ignore, the cough that feels small, then something shifts, your chest tightens, you try to breathe again and again, but your lungs don't respond. Panic begins to rise, not loud, just steady. And in a moment, you realize that you are not the one in control anymore. This is not just breathlessness. This is not just discomfort. This is the fight to breathe. Asthma is often misunderstood, underestimated, and dangerously mismanaged. But when it hits, nothing else matters except air. Inhale, exhale, survive.
Hi friends, welcome to Storytide Media, and I am your host, Scott Ogu, and this is a one-off special edition podcast brought to you by, like I said, Storytide Media. We're talking about asthma, celebrating World Asthma Day. We understand that this asthma situation is one that is underestimated, not spoken about enough, and there are a lot of people in the world that mismanage or misunderstand what asthma is. And I have with me three amazing human beings here, and we'll be dissecting and talking about this asthma situation. Mr. Bucci, Dr. Bucci. Don't let me say Mr. Bucci. That one, you might say, is an insult. Dr. Bucci, how are you doing?
Well, I'm doing very well.
I'm going to start with you. Because this is not so much of a conversation. We're trying to educate people on asthma and how to live with asthma. Maybe they have friends or family that have asthma, how to understand asthma to help these people while they have attack. Yeah. So let's just start with this. Walk us through what actually happens inside the lungs during an asthma attack.
Okay, so a very simple way to look at it is this. We look at the airways as pipes, right? And those pipes are carrying air, right? So during an asthma attack, what actually happens is three things, and they happen at the same time. So the first thing is those pipes get tighter, right? Then as they get tighter, the walls of those pipes also get thicker. And then at the same time, there's a lot of mucus being produced, which also clogs that wall. You understand? So this severely reduces the amount of air going in and out of that airway, which makes you feel difficult to breathe, all the symptoms you're having and everything. That's essentially it. And it can feel very, very, very scary when it happens like that. But that's the simple way to put it.
When we talk about asthma is very life-threatening because we see people lose air or have a shortage of air and cannot breathe. How life-threatening is asthma to someone that is in the audience that doesn't even have an idea what asthma is?
Okay. So that's a very good question. Thank you for that, because asthma is very underestimated in society. People don't take it seriously enough, I think, because it's so dangerous, because in severe attacks, that the airways can narrow so much, there's practically little to no air going in and out. And we know that air is life. You need air to go into your lungs, to mix with your blood and go to your brain. And when there is no air, you can't function. You're just there. And you have a very, very short amount of time to quickly do what you're supposed to do. Calm down, get your inhaler, relax, take it, let the symptoms resolve. But when people don't, they think it's just, I've lost friends to asthma. And it's so annoying because it's preventable. But when you don't take it seriously enough, when you don't have your inhaler on hand, when you don't have access to medical care that is nearby, before you know it, gone. So it's extremely serious.
I'm going to ask this question because listening to you, I am also trying to imagine what the lungs look like. So I'm going to paint you a scenario. I want you to give me an insight of if I'm going to have an exclusive invite into somebody's body, an asthmatic patient's body. Yeah?
Okay.
And I'm looking inside the person. I'm not saying the whole body. I'm saying inside your lungs. Yeah. You said something about the lungs tightening up.
Yeah.
How big is the lungs normally? Or your airway. Okay. How big is it? Number one.
Okay.
When it starts to tighten up, how does it tighten up? Is it that it squeezes up? Then at the points where this person uses their inhaler, what happens at that point?
Okay. So according to the lung anatomy and physiology, right, there are different sizes of pipes.
Okay.
From the main trachea to the bronchus to the bronchioles.
Okay.
They go narrower and narrower all the way down to your alveoli, which are the air sacs where gaseous exchange occurs.
Okay.
Right? So they have different sizes. And now look at it like this. You're going in, let's say this is a normal pipe. Let's say this is a normal size pipe.
Normal size.
Let's say this is a normal size pipe. Then, because it's a chronic inflammatory process, it starts the airways have muscles around them. They have smooth muscles around them. So those muscles constrict.
Oh.
One.
Okay.
Then the inflammation also makes the walls of the inner, if you have the different layers of the airways, right?
Okay.
And the walls thicken as well, just like swelling. They swell up.
Oh, okay. I think I'm getting it.
They swell up.
Okay.
And then fluid is being produced. That mucus, which is normally supposed to stop dust and things like that you trap those things and get them out when you just cough. You throw those out. What's supposed to help you is now causing more problems for you. Do you understand?
Okay.
So when you take the medication, when you use your inhaler, what happens is your inhaler goes in. It's a very mechanical process, right? The inhaler it goes in, it acts directly on those areas, directly. It doesn't even go into the blood, directly on the airways right there. And what it does is that it just relieves the inflammation. It relieves the inflammation. Do you understand? So that will eventually relieve we call it bronchoconstriction.
Okay.
Right. So the inhaler is a bronchodilator. It opens up the airway. You understand? Opens up the airway, allows the mucus to clear, and eventually allow airflow to resume, which we now know as your normal breathing. So that's
all right.
It's pretty simple like that.
So for people that get past the stage where the inhaler doesn't work, there's some times where somebody has an asthma attack and you have gotten past the stage of just inhaler because you use inhalers, you're using it 10 times and you're still having an attack. First question, does inhaler help in curing asthma as at when you have an attack? Then is it like a good solution, or do you need to go extra mile after having your inhaler? And at the point where you have passed that stage of the inhaler, what is happening inside the body?
Okay. So very good. The inhalers, which salbutamol containing, right?
Okay.
It's supposed to acutely, in the middle of the attack, it's supposed to reduce the inflammation, open up the airways, right? So that's one method. Then there are different times. There are the ones you use at the moment of attack. There are also the ones you take regularly, which contain steroids, which contain corticosteroids, right? Which also help with eventually increasing the airflow.
Yeah.
Right? So you take them at different times. But when that doesn't work, please seek medical attention. Go to the hospital. It will work acutely. At the very least, imagine having an attack, not having an inhaler, or having an attack, having an inhaler on hand. The difference is clear, right? Even if it gives you just enough time for you to actually get to the hospital where they can place you on nebulized salbutamol, they can properly, run fluid, they can properly do the whole thing. It will save you just that much time.
All right.
Does that make sense?
It does make sense.
Have I been able to answer the question?
Yeah.
Okay.
It does make sense.
Okay.
But I have this question to end this particular series of questions I'm asking, and I'll go to another question. We see cases where people have asthma attack and people apply balms. So they have balms on the chest and by like the lungs area. What is the effect of that balm? You know, does it, because you spoke about something about mucus, does it help melt the mucus? I don't know, because I'm thinking about it as a normal human being. Like, what does it do in that situation? Or balms do not work?
As far as the hospital setting is concerned, you're not going to come into the hospital, I'm going to rub a balm on your chest.
Fair.
So please use your inhalers, you know, and come to the hospital for proper treatment. I don't know if maybe you can tell me if there's some relief. Maybe you've used the balm and it's worked. Of course, if I have a cold, I'll rub balm and I'll feel catarrh and all those things relief. But a cold and asthma are different things.
Fair.
So let's not say because it works when we use cold, when we have cough and catarrh, it doesn't exactly work the same way.
I think that comes from you know, some of the causes of asthma. One of them is inhaling of cold air.
Yeah.
So I think naturally, human being, you know, we have the way we process things. So they just think, okay, because cold might be the cause, then they should apply something hot. I think that is the reason, but there is no medical proof to that it works.
Oh, fair enough. For one of the audience, anybody that's watching us right now that suspects they have asthma, how do they go about getting diagnosed?
Okay. Medically, there's a medical diagnosis for asthma, right? Because asthma is a reversible disease.
Oh,
right?
okay.
So that's the whole point. It's the point that after treatment, it should reduce. Now, I'm not going to bore you with the details, FEV1, you know, all those 12%. You don't need to know all that. What you need to know is there are clinical signs. You're having shortness of breath, you know, you are coughing, particularly in the night, you know, the common signs of asthma. We have those. And then when we measure and we see that, okay, this level is here, we give you the salbutamol and we see changes in that result and we know that, yes, this is asthma, right? So please go to your nearest hospital. You can make a quick diagnosis of asthma. Even from the clinical signs, even in resource-limited settings where we know that we may not have all these things, just by clinical diagnosis alone, we can say, okay, this is likely to be asthma. So please just visit your nearest healthcare facility. Do not wait until it comes into an acute or an exacerbation. Don't wait until it goes bad. If you're having those symptoms, you know, your chest tight, shortness of breath, difficulty breathing, cough, just go down to your healthcare provider, tell them what's going on, and definitely let them start you on something. Have your inhaler handy right beside you. You know, not until you have that, not until it goes bad, not until you have an attack before you now start running around. I'm going to tell you a story. I was on the way into Lassuth, and I was just walking, and I just saw a guy on the floor lying down, just on the road, casually, randomly, and I looked at him, and immediately I knew what it was. I'm like, "Where's your inhaler?" He said, I'm like, "What do you mean by?" You have to have this thing
with you every
if
time.
possible. Have one in several locations. Have one in your office. Have one in your car. Have one in your bag. You know, don't wait. Please, and please. It is a very, very deadly thing. Don't wait. Get diagnosed easily. Get your inhaler and just save your life. Thank you.
All right, my last question for you, Dr. Kenem. What is one dangerous myth that you've seen patients still believe that is very risky for them?
Okay. So I would say one dangerous myth is, once I feel better, I don't need to undergo any more treatments. I can just be chilling, right? Because it's a chronic disease, right? There's no particular cure for it. It's something that needs to be managed. Reduce your triggers, reduce exposure. You know, some cases it's genetic. So please, just because you're feeling like you're now okay, doesn't mean you should go and not get checks, because it can always come back. Especially if you are still exposed to those triggers. It can always, an attack is imminent at any time. Another one is, asthma is contagious.
We had that when we went for street interviews.
Please, it's not, asthma is not contagious. Please, asthma is not contagious, you know. Then some people say, oh, can people with asthma do exercise? They don't want to, you know, in school, back they say, oh, I have asthma. I'm not doing anything. In fact, exercise is good for lung function and overall health.
Yeah.
Please, when your asthma is managed properly, you can live an active, functional life. So let's be guided.
Yeah, we'll be guided.
So, what will I say? When I was in secondary school, I was running for my house, and then I noticed that after running, I have that asthma. So, what would you say about that? It's also sport, and I was younger then. I was in good health, but after running, I used that inhaler.
So, at that time, you knew you had asthma.
That was when the stuff
That was
started.
when you discovered you had asthma. So then, it's safe to say you didn't know at the time. So that you just discovered a new trigger. So at that time, having now known, obviously, there might be a bit of limitation in physical activity. You may not be able to run just as much as everybody else. But then you had not received particularly any much medical treatment. Your airways were probably still very sensitive. You know, everything was still going on at the time. So having received treatment, reduced hyperreactivity, you know, we have reduced all those things. If your airway function is now back to normal, there's no reason why you can't do those things. So it's about reducing function back to normal. Someone who, it's a chronic thing. So your airway is always going to be sensitive. But when you're taking the corticosteroids and you're using your salbutamol, what will happen is those things would reduce and you will have lungs that are essentially normal. And then avoid triggers so much. Thank you.
All right. So thank you very much, Dr. Kemen. You've done a lot in terms of enlightening even me. I don't know about the audience. I'm sure they've been blessed. But even myself, I feel like I know a lot about asthma right now. Even being a survivor of asthma. I'm coming to you, Nurse Zainab. Nice to have you in the house with Storytides.
Thank you.
So before we started this episode, you also confessed. You also confessed that you're also an asthma survivor. As a nurse and also a survivor of asthma, how do you manage asthma or asthmatic patient on a daily?
Okay, so basically, like doctor said, there is no permanent cure for asthma, but prevention is very, very, very key when it comes to asthma. So the practical way of managing asthma is just to mainly prevent yourself from the triggers. You have to know what your triggers are. Is it dusty hair? Is it cold hair? Is it perfume? And is it cough, or is it stressful activities like exercise, like she said? So when you know those trigger, then you are able to, manage it. Another thing is for you to take your prescribed medication. Don't wait until you have the attacks, and always make sure that your inhaler is with you at every time. So basically, those are the practical ways you can, prevent yourself from getting attacked every time or frequently. Yeah.
Okay, so what's the most common mistakes you see or watch patients make with their inhalers? And how do they get it right?
Okay. So actually, thank you for the question, by the way. The very common mistake I see patients, not even patients, in fact, most people that have asthma, whether you come to the hospital as a patient or not, is the wrong use of inhaler.
Okay.
I can tell you that 80% of people that have inhaler does not even know how to use it correctly.
Okay.
So when they come to the hospital, we see them come back with the same condition every time, and we are wondering what is happening. But when you start to talk to them, then you realize that all this while they have not been using their inhaler correctly.
That's interesting.
And when the medications are not getting to where they're supposed to get to, how do they work?
So how do we use the inhalers correctly then?
Okay. So with inhaler, the main purpose, like doctor said, of using inhaler is so that it can go straight to your lungs and start working immediately. It is not an oral drug.
Okay.
So it doesn't have to go in through your blood system and all of that before it starts working. It works directly on the lungs.
Okay.
So the first thing you want to do is you want to exhale fully first. And make sure that you shake your inhaler before you use them. So when you get your inhaler, you shake them. Then you exhale fully first. Then you open your mouth. Press the inhaler in. When you press it in, then you inhale deeply and slowly.
Sorry to cut you.
Yeah.
For someone that is struggling for breath, like you are almost dying here.
Okay,
And
so
you're telling me to first exhale. I really must like, you know, I hope
Yeah,
you
I
get
get what you're
where I'm
saying.
coming from, because I think at that point everybody's like, oh, I cannot breathe. I cannot breathe. Hey, I tell you, exhale first. Like we are looking at it like, bro, he cannot breathe. Say to exhale first.
no, so now the thing is, you are saying it from the angle of, okay, like, because I'm saying it step by step.
Okay.
This doesn't, it wouldn't even take you like a minute.
Okay.
So exhale now. We cannot exhale now. Like, it didn't even take 3 seconds.
True.
You get me? So if you exhale, it's just about you knowing what to do. Once you are educated about what to do, when the attack comes, you do the right thing and you get cured or healed rather. You understand? So when you exhale and you press the inhaler in and you inhale deeply and slowly, some people inhale fast, and some people they don't even press the inhaler directly into their mouth. More than half of it is already in the air.
Fair.
Yeah.
So do you get? So when you bring the inhaler closer to your mouth, you inhale it deeply and slowly. Then after that, you can relax and wait for it to work. Then if you see that like maybe after you use like 2 puffs of it is not working, you can repeat. Then if there is no any changes, then you know that is your sign to get to the nearest healthcare facility.
All right. So is there like an amount of time you're supposed to take? Like you said 2 puffs.
Yeah.
Is 2 puff like a
Standard.
standard? So if I'm going to use, is it that when I have an attack I should use, and how do I do the 2 puffs? Is it puff and I'm good, or is it puff 1, take that in, wait for some minutes, puff again? Like what's the process in terms of breaking it down for the audience?
So I would say you should use 2 puffs.
Okay.
Then wait like 5 to 10 seconds.
So puff.
Yes.
Okay.
Exactly.
Okay.
Then wait like 5 to 10 seconds.
Okay.
Then see how the condition is going. Then if you see there is no any sort of improvement, because most of the time the inhaler are bronchodilators, so their work is to simply open the airway that is now constricted. So now, do you think you are getting in more air? If you feel like you are still struggling, then you should take another puff. By the time you do that 3 times, that's already more than 5 to 10 minutes. Then you would know that, okay, am I getting better or not? And you have to also relax. You can't use, I've seen people use inhaler like, I have asthma attack. You are working, you're using your inhaler and you're still working. Like you are working on the...
So you have to sit down somewhere.
Yes, you have to be calm.
Okay.
So that the drugs can actually work and so that the lungs can relax. Yeah.
Okay, now I want to speak about children. Because
Okay.
I know when I was born with asthma, I thank God that I'm good now. So I always claim that I'm healed. Jesus has saved me.
The power of your mind is strong.
Find
Your
Jesus
mind,
wherever
it's
you
your
are.
mind. It's your mind. It's your mind.
The Storytime Media team has worked so hard to bring you this episode. So please help us by liking, because this will help the algorithm take this video to so many other people. And also comment so we have an insight on what you think. And lastly, subscribe to encourage the team to produce even better podcast shows and YouTube content. And thank you very much.
A mistake I used to make then, and it was not a mistake, I was a child, so maybe I was foolish. I basically used to use my inhalers for fun. Like, these friends blow it through your nose, so the inhalers used to finish. And my dad used to have a lot. We had one in the car, one in my room, one in my school bag. So for children that are facing this asthma, what advice do you have? Yeah. And on what the parents should know on how to help these children. And I'm not even focused on the parents. I'm talking about the teachers in school. How do these teachers help these children? Because these children are going to be in school. Sometimes school might get dusty. They might have an asthma attack right there in school. How do these teachers help these children, help stabilize these children at that point before moving them to maybe like the sick bay or,
Okay, so you said you asked one of the mistakes most parents make, then you move on to the teachers. I think because someone like me that I'm also asthmatic, I think one of the common mistake I see parents make is they simply assume that because you were fine previous minutes, so how come you are not able to read the next minute? Asthma, a child can be very okay now, and you are seeing them in next 2, 3, 5 minutes, and you are seeing that they are struggling for hair. It's not. We've seen children that people like, you just finished playing now. What's wrong with you now?
Yeah.
Asthma can go from 0 to 100. Like it doesn't give. Sometimes it doesn't give a warning sign. So I think that's one of the common mistake most parents make, assuming that because you were fine the next minute, so how come you have it now? And secondly, moving on to the teachers. So for the teachers, this is Nigeria, and I believe that most primary and secondary school they have a first aid box. But I'm sure if you go check their first aid box, you most likely not find inhaler.
I'm sure. I'm 100%. I'm saying this. I'm 100% sure you will not find the inhaler.
So you see the number one problem. Another problem is a mother has a child that is asthmatic, but the child is in school and the inhaler is in the mom's bag. You know how Nigerian parents are very protective of things like that. You understand? So for the teachers, what the parents should do first is, if you know your child is asthmatic, please inform the school.
Okay.
Let them know that, oh, my child is asthmatic. If the school does not have inhaler available, please provide your own child with inhaler. If you are thinking they might be careless because they might be playing rough and all of that, give it to their class teacher or the school, whoever is in charge there. And let them know that, please, whenever my child is having an attack, please give him or her this. So what the teacher should do in case of a sudden asthma attack, do not panic. You have to first of all, calm down. Because anxiety and you scaring the child will only complicate the matter. So you have to calm down.
Relax.
Get the child to a safe place. Let the child calm down. Put the child in an upright position.
Sit right.
So you can either put them on a chair, let them relax, or if there is a bed, wherever, just to make sure that they are upright, because that would enable them to get enough air into the lungs. So when you do that, then you get them the inhaler. Then you use the inhaler with the right techniques.
Okay, I'm going to ask this question before I get to the last question, and I move to Mrs. Mary. You spoke about inhalers being in this first aid box.
Yes.
Can inhalers be shared?
Okay, so the thing is, no, I don't think it should be something that should be shared.
Okay, yeah, so.
But in a case, the reason why I said it should be in the first aid boxes, would you rather risk someone's death? Do you understand what I'm trying to say?
Yeah.
If it's in the first aid box, at least you know that when a child has it, that's the first thing you are doing. Or you could, and another thing is, I don't think there is even enough education about asthma in the first place. Some teachers don't even know what asthma means.
Fair enough.
So when you see a child trying to catch air or having difficulty breathing, how do you even identify that the person is asthmatic? For you to even know the right intervention.
Fair enough. I think my last question will be, I would like to hear a little bit of story, but not so long, obviously. I want to share a story of a patient that had asthma, that had an attack. But I don't know, so anything about the attack that stayed with you, like you just, this particular attack, got you like, oh my God, this is something,
Okay. So as a nurse, I've actually seen a lot of cases like that. And one of the most common one is actually the wrong use of inhaler. But I will share a story, and this is my own story, by the way. It's not even a patient story.
Fair enough.
So when I was in GS3, okay, my mother is asthmatic.
Okay.
My maternal grandfather is asthmatic.
Okay.
But there is not enough education. So I'm sure my mom was just treating it. And by the way, she was treating it with oral salbutamol, not inhaler. And my mom would usually say things like, don't use inhaler. Inhaler will only worsen your asthma. If you are someone that uses drug, why should you now be using inhaler? Because it will only worsen it, because they believe that it's only when your case is already very, very severe. That is when you should be using inhaler. So, now GS3, young girl, you're just starting, your mates. So I had like this colleague, classmate that told me then, oh, there is this perfume that is nice. perfect line. I'm not trying to shade any brand, but I don't even think the brand exists anymore. But that was the name of the perfume. And as a girl, I bought the perfume. Anytime I'm going to school, I would spray the perfume. Because I know my mom is asthmatic, I would collect my feeding allowance before I spray the perfume. So I would spray the perfume. But then from my window when I'm going out, then she would perceive it. She would say, she would call my name, Zainab, you have used that perfume, Abby? I only thought it was a joke because I never had like a very, very severe attack. It's just like minor things that I would just use joke and it's fine. Then like few weeks after the use of the perfume, I came back from school. Just told my mom, I'm not feeling well. Then she called someone to take me home. I went home. I realized that I couldn't breathe. Nobody was at home.
Mad.
Because my mom was supposed to come like few hours after that. So then I started struggling. Then I went on the streets. I was trying to get someone that I could use their phone to call my mom or something. I know my mom number offered. So I got someone, I called my mom, then she took me to the hospital. When I got to the hospital, they gave me an injection. No nebulizer. They gave me an injection. I went back home. I can tell you that between that evening, that should be around 6:37 at that time. Between that evening till the next morning, I took about 6 injections.
Okay, what was the injection for?
So that injection works for me because when I was small, I was
Honestly, till this very moment, I wouldn't say I know what injection it was. But all I know is they would give me like, when I got to the hospital, they gave me 2 injections. I was taken back home because my mom believed that like I'll be fine. Then midnight, I wasn't okay. She had to take me back.
Fair.
Like twice that midnight till the next morning.
Is that they didn't have nebulizer or what?
I don't think they had nebulizer because I wasn't given any. And at that time, I was not yet a nurse. How would I know? And my mom too was not like she doesn't know much about it as well.
Well, I think it's different body because when I was small, they nebulized me and then I was still having the asthma until I got the injection. I was fine. So I think it's still different.
What I realized from it is I could have died that night.
Yeah.
What if my mom didn't have a means of transportation?
It's crazy.
So then I realized that asthma is not something you should joke with, and proper education is needed.
Yeah.
It is really needed because this can go from 0 to 100.
Yeah.
And hospital should please. I don't think nebulizer is expensive, is it?
Not crazily expensive.
Not crazily expensive like that.
She sued the hospital. Well, anyways.
No, I'm
Let
good.
Nigeria not happen to us. That's
Exactly, that's the word. Let Nigeria not happen
Okay,
to
so I want
us.
to ask for people who are new to being asthmatic, and when you give that person the inhaler, do you show them how to use it, or you just you're an asthmatic patient, take the inhaler and go?
Honestly, for me, I think it
To
depends.
show them how to use it.
Yes, that's the right thing.
No, because she said now that some people don't know how to use it. What if they were not taught how to use it in the first place?
I don't
Yes.
think people even
No,
thought.
the reason
That's
is
a big
because
problem.
sorry to cut you. The reason is because in Nigeria we self-medicate a lot,
Yeah, true.
and because people know that inhaler is one of the cure or is the cure to asthma. The moment they know their child is asthmatic, they don't go to the hospital.
They just go buy inhalers.
Or if they see that it's a similar symptom to somebody, or maybe their neighbor or somebody they know, they just go to the pharmacy. And pharmacy are not trying their best, let's be honest. When you go to the pharmacy and you say, I want to buy inhaler, they will not ask you, have you used it before?
True.
They will sell it and collect the money and you go.
They're running their business.
There's
Exactly.
a lot of education we actually need to do. There's a lot we need to do.
So that's it.
Okay, moving to Mrs. Mercy. Mrs. Mary, sorry. See,
Yeah.
I've said somebody else's name. She's looked at me like, who is this guy talking about? It's not me. Mrs. Mercy Adigo. Mrs. Mary
Oh
Adigo.
my God.
I keep saying Mercy, I'm sorry.
Yeah,
God
it's
have
fine.
mercy on me.
Amen.
Who is Messi?
We have to ask.
That's the
who is
question we have to
Messi?
ask. Who is Mercy?
Who is Messi?
Mrs. Mary Adigo.
Yeah.
At what point did you realize that asthma was going to be an important or a significant part of your life?
Well, let me just say I started having the asthma when I was 15. I
Fair.
did not know. I was just, anytime I'm playing and everywhere is dusty, I just found out I'm having this serious allergy. So I just take the allergy drugs and then that's it. Until one time like that, I started seeing that I was actually breathing very fast, and then my teacher had to call my home to tell them that okay, there's something wrong with her. Even gave me another sickness. We're not African period now. They were like, God forbid. So that's when they took me to the hospital, and then that's when they said that I had asthma, and then my lungs were already choked up already. So they incubated me. They gave me a lot of drugs. They gave me injections. Then I was complaining that why is my chest so wide, because I was in pain. I was really, really in pain. But I thank God now I'm able to control it. I'm not able to panic. I know what to do when I'm having that asthma. So I understand that a lot of people don't really know what to do at that moment, but that's why we have asthmacation. So we are able to educate people on what asthma is all about. People, those teachers, teachers, parents, and any other person, colleague. So
how did you say, being 15,
yeah,
did you think you're gonna die? Like what was
obviously,
what was going on in your head? You're like, oh, you know what, I'm
when
dead.
you're in pain, constant pain. Like, do you know what it feels to have mine? I don't know about hers, but mine, if I'm having asthma, so imagine breathing in and out, and then somebody is pinching you, you're feeling that pain. Breathing in and breathing out, you're feeling pain.
It's painful.
So that time my tummy works, my shoulder, because I have to inhale a lot. So it's very painful, but God knows.
Can you describe it? Was that the worst attack you had?
Oh no.
Okay, can you describe a really severe attack you had?
So, well, I'm a very emotional person.
Yeah.
My attack can come when I'm crying, or maybe when I'm in a dusty area, or probably when I take perfume that is very harsh, or it can come at any time. So, let me say my worst asthma attack would be when I was still a kid. So, that time, it was around 2 a.m. I used my inhaler. My inhaler was not working. I did not want to wake anybody up because I was very, very, I didn't want to disturb anybody because I'm asthmatic and all. So I was breathing in and out during that period. I was like, God, please don't make me die. Please don't make me die. I promise I'll wake them up when it's 7 o'clock. So I was having asthma throughout that period. So
Are you serious?
And yes, so
it will get worse.
I did not have a choice. 7 o'clock, I told them I was having asthma. When I went to the hospital, they incubated me, but I was still having the asthma. I said, doctor, you have to give me injection. They always give me injection when I'm having asthma. Why can't you give me that injection? The doctor was like, it's just the power of my mind. I said, please, can you give me injection? So when he gave me injection, I went back home and I came back and I told him, okay, I'm fine. So, but he told me to come back in the evening, and then he gave me another injection again. But I don't know. But now I don't need injection like I was when I was younger. So that's it.
All right. I have one question for you.
Yeah.
So what has asthma taken away from you? Number one. And what is something unexpected that asthma has given to you?
Well, let me say asthma has taken away my freedom, because there are some certain places I can't go. Like in a crowded area, I know that obviously if I'm in a choked up area, asthma can trigger at any time. I can't use some perfume because I know it's going to trigger. And especially food. When I smell something very nice and it's very harsh, asthma can start because I have
especially palm oil related.
You get, I can't even bleach oil. You get.
Yeah.
And what's unexpected? Okay, let me say, it has made me self-aware. I always have an inhaler in my office and also in my bag. So in case of anywhere, and I also look at my surrounding, who also have asthma like me. I understand it's not hygienic, but my life matters more. So in case if I forget any, I can be able to fall back. Okay, this person has, and also I can also be help to other people.
Yeah.
So I'm also very proactive in all that, and like I said, asthmacation. So to educate everybody on what asthma is all about, to prepare.
Well, my final question for you before
Okay.
I then have a rapid question for everybody. For someone that is newly diagnosed, and is frightened, like how you were when you were 15 years, what's something you wish somebody told you then?
Don't panic when you're having asthma. Please don't panic, because it's only going to make it worse. Like over 400,000 people globally have died of asthma, and I feel that death has to do with being panicking and all. So I feel they should not panic, and they also should look at their surroundings. If you're a student, kindly look at your classroom who has asthma. So in case if you didn't carry it, you can fall back to that person. In your hostel, have one in your hostel, have one in your bag. Also have one where you move around. If you have 3, I understand that there are some certain places that like in my area now, I just found that asthma inhaler is 7.5, and then when I went to the market because of this asthmacation thing, I found that asthma inhaler was like 3,000 naira. So I understand that it's not everybody that can that has that funds to buy that inhaler. That's why people die of asthma. I don't know, but at the same time, pharmacists should please give the actual price to inhaler, please. So
thank you very much, Mrs. Mary Adigun. I didn't make a mistake. I didn't call her Messi. In case you are waiting for my mistake, you're waiting for my downfall. But yeah, this has been amazing. I've learned a whole lot from this. I'm going to ask the 3 of us an interesting question. It's a rapid question. If you could put a message on a billboard for the whole world to say about asthma, what would it be? Starting from Dr. Kemen to Dr. Kenim.
Where is your inhaler?
Hey! Nice one. Tough. Okay, where's your inhaler? It's cool. Nurse.
Honestly, I'm kind of blank, but I think I would say asthma education is important.
Asthma education is important. I think I like that too. Asthma education is important. All right, so
like I said, don't panic, be safe.
Do not panic, be safe. Okay, he has one more. Doctor has one more.
Puff, leave.
Okay.
That's nice.
Okay, that's the best for me. I know why it's the best for you too. All right, thank you very much for being here with me. Thank you very much for being here with Storytime. We hope to educate a lot of people, because even from this conversation, I understand that even myself, me that I'm an asthmatic, or I was an asthmatic patient, I don't know enough, because it's like understanding that, even the usage of your inhalers, there's a particular way you should use it. Like, there's a whole lot that people need to learn. We plan to do more. Thank you very much, Mrs. Mary, for coming up with this initiative. Like, the first time we had a conversation and you spoke about this, it was really I noticed immediately that it was emotional for you. It's a very sensitive conversation. And for me, it was the same thing, because I've seen a lot of people, have asthma attack, and they come to call me from another part of the house, even in the hostel. Like, someone has asthma attack. You're the one that knows about it. They come and talk about it. I'm an expert. What am I supposed to do? I'm not a doctor. Like, I understand how passionate you are about it, and it's something we really need to sensitize people on. And thank you for this initiative, for bringing up this. And we Storytime, we are ready to move beyond and above, to make sure that this vision that you have is something that comes to life, and we help a lot of people around the world. On this study, I noticed that there are about 260 million people living with asthma. Is a whole lot of human beings. And, thank you very much for watching this episode. We plan to come up with a lot of other exciting things that will help you.
If this episode moved you, share it. Someone in your life or contact may be living with asthma right now, and this will be very helpful for them.